Hello everyone, welcome back to my channel. So today I'm going to be doing a what's in my clinical bag video. So if you don't know, I am in nursing school. I graduate this December 2020. I'm in my last semester right now and I have clinical 1 day a week. So this is just what I take in my clinical bag. If you're interested, keep watching. So first off, this is the bag I take. It's a backpack pretty much. I feel like it's easier than carrying one strap over my shoulder, but I know a lot of people do. But I just had this bag and I wasn't trying to buy anything else, so I just have this. So starting in the big pocket, this is a new addition. This is a face shield, and because of everything with COVID, the hospital gave us these face shields to wear. Honestly, we don't wear them because we have goggles, but they gave us these. They're huge. I haven't worn it. As you can tell, it's still in the package, but yeah, see, it would just be like that, you know, but clear. This is just a blue film that's on it. But yeah, it's pretty intense. Some people do wear it, like some of the hospital workers, like the staff, but I haven't worn it. So yeah, takes up a lot of space in my bag. But this is what I do wear. I wear these goggles. We're supposed to wear them each time we go into the patient's room. I know it's a fashion statement. Yeah, so I wear these. Sometimes I forget that I'm wearing them. The staff don't really wear them, so I feel like you can definitely tell that I'm a nursing student when I have these on. But it's fine. Keeps me protected, I guess. All right, next, I have this little notebook. I just keep random notes, or if my clinical instructor tells me an assignment we have, you know, I'll just write stuff down in here. I mean, I love this notebook, actually. I've written a lot of stuff down here, not even for nursing, but it's come in handy a lot when I have to, say if I'm looking at my patient's chart and I don't understand something, or I have to look something up, I'll look it up, but then I'll make a note of it so I can look back and go over it just to make sure it's stuck in my brain. So I would recommend having a little notebook because there's so much that you learn during clinical, and it's nice to just have it all in one place. I have my handy dandy stethoscope. Oh, just hit myself. I have my stethoscope. It is a Littmann, just black. Looks like that. I love it. I'm still learning the sounds and everything, you know. I mean, it is my last semester, but I feel like we haven't had a lot of practice with hearing different lung sounds and heart sounds and stuff like that. And I think a lot of that has to do with the fact that with COVID, our clinicals have been shortened. Like we didn't physically have clinical for a long time. So hopefully I hear more lung and heart sounds when I'm in my CRT, which is coming up in like 4 weeks. So I'm looking forward to that. But I do love my stethoscope, and I usually just wear it here or put it in my pocket during clinical. All right, next, I just have paper. This is what I like to write my report on for my patients. I just use a plain piece of paper, honestly, and I fold it into forts, and I'll put my patients' like information and stuff in each square. So that's just easiest for me. I know everybody does it differently. There's this one paper. Hold on. Okay, I don't have it. Anyways, there's one paper. Oh, here it is. Okay, that's kind of bad, but I just scribbled on it. But here, we'll go like this. This paper, it does have my school's name on it. Okay, this sheet, I don't know if you can really tell what I'm showing you, but this is a sheet that a lot of nurses and even nursing students use and report, and it just helps you organize things easier. So you have like your patient's name, age, and room number. You have their admitting diagnosis, and if they have or had surgical procedure. You have their past medical history, past surgical history, and their allergies. And then here it's like if they have IVs, you'll put where the IVs are, pulse ox, diet activity, their vital signs, base vital signs, all of that, lab procedures. So, I mean, it is nice to have. I just don't use it because I'm really scatterbrained in the way I think about things. That's why I like to use a blank piece of paper. But they use these a lot in nursing school. So, I mean, in my nursing school, but I feel like they would use these a lot in other nursing schools as well. And then we have to do head to toe assessment. So we have these sheets. That just go over our whole head to toe assessment. And this is not the sheet, but I don't know where my papers are right now. I didn't plan. But yeah, so we'll have the head to toe assessment sheets. We can go over those. And then we also have this S-bar sheet. It has come in handy, especially in our simulations that we do. We always have to give an S-bar. So yeah, those are really the only pieces of paper I have with me when I'm in clinical. And I keep them in this folder, which looks really bad because it's been stuffed in my bag, but yeah, I keep it in that folder. Next I have some random masks in here because, you know, I always gotta have a mask on. And I just have these just to make sure that I have a mask for my clinical day. I mean, they do give you some at the hospital, but I just like to have extra in case I forget. In case I forget to bring it with me, or if something happens to my mask or whatever, I just like to be prepared. And then I love to eat. If you see my other videos, you know that I love to eat. Oh, ciao. Okay, if you see my other videos, you know that I love to eat. So I have this Nature Valley bar. These are really good, but they honestly are so dry. So I always have to make sure I have water with me. But then I also have this applesauce. So I don't know. I have these two in my bag right now. It does change, but that's what I have at the moment. And then, okay, that's pretty much it for the big pocket. So now I'm gonna move to this little pocket. In here, I have a watch. My clinical program, or my program in general, they want us to have this kind of watch with the second hand on it. And they really prefer for us not to use Apple Watches, which a lot of nurses use Apple Watches. So, I mean, maybe I don't know, that's just how my program is. But I have this cute watch. My grandma actually got it for me. She got it custom for me, and it says my name. I don't know, I don't think it's really showing up that well. Well, it says my name, and then it has like some nursey kind of stuff on there, which I think is really cute. So yeah, that was my watch. And then we always have to wear our name badges. I'm not going to show you the front part because it has my information and my school on there, but yeah, this is the badge. And then I really love these little extender things because it's just so easy when you have to, you know, use it just like real quick. So that's that. And then I have some pens because I have pens because you need pens to write down your patient's information, sign things, whatever. You always need pens. There's this one pen. These are my favorite kind of pens, but they haven't been working that well for me lately. So I also like these. I use these. I mean, any pen, whatever. It's just a pen. And then I have 2 pen lights because, you know, you need these to check your patient's perla. Make sure their pupils are equal, round and reactive, and accommodating to light. And then they also have the pupil measurements right there. I use these when I do head to toe assessments, and yeah, that's pretty much all I use them for. And we also use them during simulation. So yeah, I have those. And then I have these scissors. They're just like, you know, for cutting the tape and whatever else we need to cut. If you're in the ER, you might need to cut somebody's clothes with these, you know, but I haven't really used these that much, but I have them just in case. And my scissors and my pen lights, I got them both off of Amazon. I have this lock because sometimes we are able to have lockers as nursing students. Other times, like we don't have a locker, so I don't really need this right now, but my last semester we did have lockers, so we had to bring our own locks to keep our stuff locked up. And then lastly, I have lotion because your hands get really dry because you're constantly washing them, sanitizing them. So it's just important to have lotion or something to keep your hands moisturized and not crusty. That's pretty much it for my nursing bag. If you're in nursing school or a nurse, let me know. Oh, I forgot one thing actually. So this is gonna mess my setup up. All right, I have this book. It's called Nursing Diagnosis Handbook. It's actually propping up my video situation now, but I have that because for clinical we have to do nursing diagnoses, and this is a whole book full of nursing diagnoses. It gives you all the related to factors, and then also things to go by for the as evidenced by, because you know it's like your diagnosis related to as evidenced by. So we use that book. I've used this in pretty much all of my clinicals because we have to do concept maps, and on the concept maps we have to include nursing diagnoses. So that's been really helpful, and that's what I use. So yeah, I hope you enjoyed this video. If you're in nursing school or a nurse, or you know, just let me know what you keep in your bag, and let me know if you found this helpful. And thanks for watching. Bye.